Today, I'm delighted to speak with a colleague that I've known for several years now, Dr. Lisa Palmer. She has a PhD. She's a licensed mental health counselor, program and clinical director of the Renew Center of Florida at therenewcenter.com. Her miracles in counseling have helped many high-profile patients and celebrities overcome and release the devastating grip of trauma, addiction, eating disorders, and relationship concerns that are currently prevalent in our society. Her wellness center combines state-of-the-art approaches and integrative medicine. Her professional and personal life experiences help to make her not your typical run-of-the-mill psychotherapist. Dr. Palmer is a former adjunct professor at Nova Southeastern University, former Miss USA contestant, former TV news reporter, and guest on many different media platforms, including print, local, and national radio and TV shows. Dr. Palmer is a past president of the Palm Beach Association for Marriage and Family Therapy, where I first met her, and an approved marriage and family therapist supervisor in Florida. So I'm delighted to welcome you, Dr. Lisa Palmer.
Well, thank you so much. That's quite an introduction. And most of all, I'm a friend of Dr. Goodstone, so that's probably the biggest accolade that I have right there.
Oh, thank you. You're doing such incredible work, and it's unique. So I'd like to start by asking you about your training and your background and what led to your deciding to become a therapist and then focusing on the areas that you focus on.
Well, wow, that's such an interesting question because I have a very multidisciplinary background. Probably in my early college years, I decided that I wanted to be pre-med, so I did end up studying a lot about the body and anatomy and physiology and all that. And then right around that time, I was taking a lot of philosophy courses as well, and I just had a lot of different interests. And right around that time, I competed at Miss USA as Miss Vermont, and that kind of sort of changed the course of events for me. And I got really interested in sort of the entertainment side of things. And I guess I had the hopes that I wanted to reach out to people and make a difference using media as a way to do that. So I then became a journalist, and I kind of, had a brief stint in that, working as a general assignment news reporter. I worked at the White House. I did a lot of different things with regard to media, and I kind of realized that while I was writing stories that were mostly negative, I wanted to make an impact on people by helping them to write stories that were positive and life-changing. And that's when I, had a huge breakthrough and decided that I needed to make a change myself, and then decided to enter the field of therapy. So that's sort of when my journey there took place, and I started with a master's degree and then got my doctorate, and it's sort of like all of these different interests that I had came together as one, and so here I am.
Oh, wow.
In a nutshell, right? That's pretty much how it happened.
That's incredible.
Yeah.
So I know that you work with eating disorders, and the last week in February is Eating Disorder Awareness Week. So I thought I'd start with that. How did you get interested in the topic of eating disorders?
I always get asked that question. It's very interesting because of the fact that I always had an interest in women's issues, and we know that eating disorders not only affects women, it affects men, but it was something that always interested me, and I kind of got into that because really after college I did my residency working with women with eating disorders, and eating disorders happens to have the highest mortality rate amongst all mental health illnesses, and it happens to be one of the most challenging issues to treat because it's not just about food, it's not just about your mental health, but it's also your physical health, your relational health, and how all of these aspects of life intervene with each other. So, it becomes more challenging for a practitioner to work with eating disorders, and I feel that the practitioner really has to be skilled in order to help to bring the person to total health and wellness as well as their family. So it interests me. I like the challenge, and I happen to be pretty good at it. So that's
it's great to know that.
Yeah.
Boy, so
we all find
need
that niche. We all find that thing that sort of fits us. But the gist of my work also with it is working with trauma, because a lot of my patients have trauma, and whether they have an eating disorder or they have an addiction, most of the time you have to be very good working with that piece of it too in order to help people to heal from whatever it is that they're suffering with. And that's also my specialty.
Well, I'm curious about how a typical patient would work with you, like what kind of results you achieve with them. I've seen that you seem to get an awful lot of testimonials from very satisfied clients. So how do you work with them?
Well, I think the first thing is that, every patient is an individual, and they have to be treated as such. So I start with an assessment and strategy session to kind of figure out what is, their past, their present, and their future, what the way that they would like to see themselves, and how their symptoms are, what they're complaining about, what are the changes that they would like to see, their thinking process, and figure out sort of the source of their problems as well as, the way that I work to resolve them. So I think that, it starts with a proper assessment, and then from that point I can kind of determine about how many sessions over what period of time I'm going to need to work with them. So I think getting a really good structure in place is sort of a foundation for the way the intensive therapy is going to look, is a starting point. And then from that point, we take a very integrative approach, not just working with the psychological aspects, but working with the health aspects as well. So we're really treating our patients, organically, so that they can see results within themselves while they live in their reality-based settings, which is phenomenal for them. And that's one of the things that
draws. They're not in a special locale for a week or a month or 2 months. They're in their own home?
Right. They may be living in their own home. They may be living at, a halfway house, but they are living in their reality-based setting where, they can work, they can go to school,
okay.
And they can see the results happening while they're living in their own setting, so that they know that this is real.
I want to add something there. I have visited many treatment centers, and I noticed that they can be very happy while at the treatment center. I remember some sitting around a table, someone playing the guitar, they have all these friends around them, but then they go back to their own environment, and they have to really be prepared for that. So you're working while they're in their own environment.
Right. Well, and that sort of changes how you do therapy. Okay, so it's actually more challenging for the therapist. It's very much possible, but the therapist has to be very skilled, because there's a lot of factors that can obviously influence when a person's living in their own environment. So their environment also has to adjust according to them as well. But you're right, when someone is, say, in an inpatient treatment center, a lot of the outside influences are sort of quarantined. They're blocked from them. And they're, able to focus on certain things with regard to their, their own healing and recovery process. But once they're put back into their reality of life, this is where we see a lot of the old patterns begin to reemerge. So one of the things that we really look at is something where we look at how we can change the mind code of the person and the reprogramming. It's not just looking at cognitively changing the behaviors, but really getting into what is the programming that is sort of defining the actions of the person. And there's different ways to, through different therapeutic processes, to, change the coding so that the person is not necessarily reacting the same way that they were before, and therefore their behaviors are changing, and they can, lead a more happier, healthier life without the sabotage.
So that leads perfectly to my next question. What psychotherapy approaches do you use? What tools and approaches?
Yeah, I get asked that question a lot because obviously, people want to know what the tricks are. And, the way that I actually practice many, many different approaches, first of all, which a lot of therapists don't. A lot of therapists stick to one or two, and they say, this is what I do, and if you don't do what I do, I can't work with you. I don't work that way because every patient is so different, and the needs change according to, what's happening on the case. So I think that the more tools that the therapist has access to and knowing how to use those tools helps the patient to, and everything to get better quicker. I have multiple tools that I use, and then I have some that only a handful of the people in the world know of. One of my prized tools is helping people to overcome invasive thoughts and memories with some techniques that I have that actually help to change the emotional responses that are related to memories. And we've seen with this that in a very short period of time, usually within a 20-minute period, when a person goes back to revisit the memory that was causing them pain, we see a drastic difference in their emotional response. They may not even see themselves in the memory, and they feel drastically relieved. And this actually affects how they act and behave, in life and even toward themselves as well. And there's a technique for that. And it's like, I will tell you everything I know, but I'll tell you a lot of what I know, but not everything that I know. But it does work. And it is just a different way of reprogramming a memory, because our brain actually processes an invasive trauma memory different than regular memory. So if we can go back and we can change the way our mind sees what has happened, it can really change everything. And we do that through the subconscious.
Wow, it sounds powerful. I know that I do a type of mind-body awareness therapy, and that accesses the deep unconscious. But you talk about something called reality-based therapy. Tell us more about that, or what it is.
Well, the reality-based therapy part of it is, it's not a specific technique, that one. That is just more of a model for how I see people being able to make progress while they're living in their reality-based setting, in their own setting, so that we can work with their environment as well as the way that they, sort of exist in that environment to help them to make changes, so that they don't necessarily have to be removed from their day-to-day life. Because this is a problem that I see a lot of people getting stuck and becoming institutionalized. And they either end up going to inpatient treatment over and over again and not ever really becoming normal or having some normalcy in their life. And I find that wrong. My goal for all of my patients is to get better so that they're not lifelong customers. I want them to be able to fly and be free. And I think too many people get stuck in the system, and, they go to therapy and they're going year after year after year, and they're really not getting better. And in the long run, it's not helping them. So my goal is to really get them fixed, get them happy, and get them moving on and being able to live life the way in reality. So
that sounds incredible. And you also use hypnotherapy as one of the tools. So tell us about how that works and how you use that.
Well, hypnotherapy is very interesting. I get a lot of inquiries about that, and I use it all the time. But I don't always do trance work with people. People don't realize is that with hypnotherapy, when you're a trained hypnotherapist, this is not like a hypnotist when you go and you watch a magic show and they call people out of the crowd and they say act like a chicken, and then people start acting like a chicken. Those people are already sort of customers for that. Okay, so when those hypnotists are doing, their magic shows, like again, those people are customers for that. When people walk in the door to see me, they have a problem with overcoming their own resistance. They already know, many of them, what they need to do, but they can't do it, like a diet, for instance. They may know everything about nutrition, but yet they cannot, follow the plan. So they have a problem with overcoming their own resistance. So when it comes to hypnotherapy and therapy, it's a lot more complicated. And what people need to understand is that in hypnotherapy, there's something called trance work. And that's where you really are working with people on a more abstract plane to help to access their subconscious in order to make suggestions about whatever it is the goals are that they have. But really, therapy and hypnotherapy is about, opening people's minds up to different possibilities, and then using suggestion to allow them to follow along the path of the possibilities that are in alignment with the goals that they have for themselves. However, you don't actually need to do trance work where you're working on a subconscious level with people in that regard, where they're maybe, experiencing colors or they're seeing things, and then you're working on that plane in order to access their subconscious to make changes with them. So I'm always using hypnotherapy techniques, but I like to talk to people while they're in their conscious mind. And then
what stood out for me is when you said that you offer suggestions in alignment with their goals. Because I know there's therapists, I've been to sessions where they're giving suggestions that are not fitting with me. They're not resonating. So you said in alignment with the patient's goals.
Well, yeah, you have to, because here's the way that you see it. I see therapy as a collaborative process, and basically the patient is an expert at their own experience, and they're bringing in data to you about what they're experiencing in their life. And as a therapist, I'm an expert at change. I'm an expert at the physics of change. So it takes sort of the two of us to, put together a blueprint for what it is that they want, but it's really the therapist along with the patient who together are going to bring about this change. And using hypnotherapeutic tools and using some of the other tools that I have, I can help people to access their subconscious in a way where they're now starting to have these sparkling moments that are actually in alignment with their goals. So then they're coming back to me and they're saying, Dr. Palmer, I realized that I was taking better care of myself this week, or I felt more trusting in a relationship, or I was able to do something that I never thought that I would be able to do. And a lot of times they don't understand how these miracles are sort of happening to them, but based on my knowledge of therapy and being, understanding the physics of change, I know what kind of interventions that I've put in place to bring that change about. Does that make sense?
Yes,
so
it does
you're
make
always
sense.
using hypnotherapy. You're always using hypnotherapy because basically therapy is all about linguistics, and you're using you're using language, okay, in a very, very powerful way at all times as a therapist, what you say, what you do, how it's said, and there's suggestions that are coming in all different forms, whether the patient knows it consciously or not, that are forms of intervention. And those interventions are going to be in alignment with the patient's goals, because they shouldn't be aligned with my goals. They should be aligned with the patient's goals, because that's how the patient is going to know that they've arrived and that they're making progress. It's their life. They're just coming to me to say, this is what I want.
You're doing something that is affecting the synapses in the brain, like new connections, like the connection that they had before to the negative thinking can change.
Well, yes, I am extremely, very much aware of the neuroscience as well behind our behavior. And our mind and our body are very much connected to each other. So first of all, how we nourish ourselves, what we put into our bodies and what we don't put into our bodies, and toxins as well. All of these have an effect on the activity of the brain and the connections that are happening there as well. Serotonin levels, dopamine levels, neurotransmitter levels sometimes are a problem with someone with anxiety or lack of motivation, for instance, and sometimes they're not. That's what also people need to realize. Sometimes somebody has perfect serotonin and dopamine levels, and they're complaining about depression and anxiety. And we see in certain scans that we do, or certain neurotransmitter tests that we might administer, that there really isn't a problem with their serotonin and dopamine. So there's a problem with their programming.
Right.
So no wonder why these patients, when they've reported having taken all these medications and not getting better, no wonder why. Because they're being treated for something that they're being treated for in the wrong way. They're being treated for a serotonin problem when they didn't have a serotonin problem. So they get a side effect from that. And the side effect from that may be a feeling of fogginess. It may be difficulty sleeping. It may be a libido issue. It could be a lot of things, and these things also affect your relationships, your life, et cetera, and has a sort of a spiral effect. So, we look at the connections. We look at what the brain's doing, how the brain's affecting the body, how we can nourish the body and the brain, and basically helping the person to revitalize and get to overall health.
Wow, it's just not a simple process. And
it's not.
That programming that we have is so deep, and it's so old from very young ages that it's very hard to access it. You really need a skilled therapist. So now I have another question.
I was going to say that you're absolutely right, because a lot of people are operating with core negative belief systems that need to be altered, and these core negative belief systems are taking root in their lives in different ways, affecting their relationships, affecting their success, affecting the way that they feel about themselves. And until those core rooted belief systems are actually changed, they will likely see a pattern of failure in those areas that they might like to succeed in.
Absolutely. So I know you also do intensive therapy for quicker results. So which clients come for intensive therapy, and when does it work or not work?
Well, the way that my practice is, the way that my center is going now, pretty much all my patients are intensive therapy patients. I don't really take on small cases anymore. I don't really take on people who just have, a mood issue. because that's easily resolved for me and them. That's very easy for me to change. Usually when patients see me, the first thing that changes pretty quickly is their mood. Mm-hmm. So I tend to take on more complex issues that are more interesting, and that where people, where my services can really be served for people with these kind of problems. So all my patients are intensive patients, and they are all on 60 to 90-day plans, and sometimes I'm doing what I need to do with them. Some of them are being seen every day. Most of them are being seen a few times a week to begin, and the sessions are not like your average 45-minute sessions. They're usually hour and a half, sometimes to 3 or 4 hours. So the dose of sessions is also really important. How the sessions are used in the therapy, and when my patients are working with me, they understand that I need the flexibility to use the sessions with them as I see fit, so that they can have more rapid, accelerated progress. And I tell them pretty much exactly what they're going to be likely to expect through the course of the treatment, what they'll see first, second, third, and what I'm going to need to do in order to get where I need to go, and the kind of time and structure they're going to need to give me. And I can only do that because I know how I work, and I know, in my work with so many thousands of patients, how things have unfolded, so I'm doing it, and I'm making those suggestions based on my track record and based on what I've experienced.
Yeah, what I like is that you set it up for them in advance so they know, what they're going to be expecting. And then it's up to them. They decide, am I willing to do this? I also... Yeah,
because it is a commitment, but it's really not a big commitment. Listen, I have patients that some of them could be in therapy the rest of their lives, okay?
Right.
Some of them could be in treatments the rest of their lives. And these are people that I'm taking on, and within a short period of time, they're being healed. So it's really picture of things. It's worth it for them. But like with any patient, especially ones that have never worked with me before, maybe they've heard about me or they've seen a testimonial or whatever, they're really putting their faith forward to say, I believe in you, I believe in this, I feel good about this, and I'm going to take a risk here. And usually they're not disappointed, which I'm happy about, because for me, results mean a lot to me. This is not just how many patients can you see, but it's what's the quality here and what are the results. The results mean as much to me as they do to my patients. And if my patient isn't progressing, I put it on myself that I need to do something different, which I do, in order to help them to change.
Wow, it's so much. I could ask more and more questions, but our time is running out. So why don't you share with us two things. A last message, what your message would be to our listeners, and then how they can get in touch with you.
My message to the listeners is that everybody goes through growing pains of life, and everybody goes through trials and tribulations and traumas. It's part of life. But your traumas don't have to take a hold on you for the rest of your life, your grief and loss, whatever it is. But with anything, in life, you have to make a sacrifice in order to get where it is that you want to go. And maybe as you've gone on through your life, you maybe have been disappointed. Maybe you feel like you've already taken enough risks, but it just takes that one time and that one person and that one opportunity to make a big difference. And a lot of times people don't want to invest in their health, but if you don't have your health if you don't have your mental health and your physical health, you have nothing.
Absolutely.
So you have to think about yourself first and do whatever it takes so that you can be, all that you were meant to be.
Incredible. So tell us how people can get in touch with you.
They can go to therenewcenter.com, www.therenewcenter.com, or they can go to 800-557-6090. And don't all call at once, please. We can't handle all the calls, please. No, but seriously, I just want people to remember what I said and to remember that your health is the most important. And without that, you have nothing. And don't be afraid to make the sacrifices that you need to make in order to have a better future, because it can happen.
Thank you. What a wonderful message. Thank you so much, Dr. Palmer.
Thank you so much for inviting me on the show, and anytime.
So I am your host, Dr. Erica Goodstone, saying goodbye for now. Please visit my website, healthybabyboomersnetwork.com, to get your free report, How to Live to 100 and Beyond, and be healthy and happy. If you're ready for love, join the 30-Day Love Challenge, which will be coming again soon. And just go to my website, drericagoodstone.com, for more information. I look forward to speaking to you again soon.
Hi, this is Maury Moreland Morrison, here to tell you Geico has more than just great savings. Much more. Geico's been around for more than 75 years, back when they were using Morse code. Sorry, that's just my sense of humor. What's more, with Geico you get 24/7 access to licensed agents on the app, online, or over the phone, so you can talk to them at night or in the morning. So forevermore, just know that no other auto insurer has more than Geico. More power to you. Geico. Expect great savings and a whole lot more.